It's 6:30 on Tuesday the 9th, so we are talking all about digestion. So I'm going to give a couple minutes for people to join up because we're only about 20 seconds in here. Remember, if you want to type in any comments, you are welcome to, and I'll try to keep an eye on those. There's a little bit of a delay, but I'll try to keep an eye on it. So what we are talking about when it comes to digestion is not just what is digestion, right? Because we all kind of know what that is, right? And we'll go into a little bit of a definition. But why is digestion really important for us to know, both for ourselves and for our family? So if you're a parent, why is it important for you to understand kind of the process of digestion, what happens, why it happens, and then symptoms and why symptoms happen? So that's what we're going to talk through. I want to touch on what I learned as in nursing school. So back about 15 years ago when I was in nursing school, I learned a lot of the basics of digestion. So I learned the stomach and what it does, and the intestines and what they do, and kind of the basics of the digestive process, right? When I started studying more holistic medicine and when I went back to school for functional nutrition, I learned a very, very different approach. So rather than looking at each individual organ with the individual issues that they might have and how to heal each individual one, I learned how they all work together and the importance of seeing them as a very cohesive unit. And it goes a lot farther than that. So it goes a lot farther than just the digestive system, seeing that as a unit, but the whole body. Tonight, we are only talking about digestion because we really only have a small amount of time, right? So we're going to be here for 30 minutes or so, just kind of talking through the basics. So there's a lot that we're not going to touch on because that would take way too long. But as far as the kind of the main key points that I want to bring up that I use, and kind of my process that I use when I am working with people who are struggling with digestive issues, that's what we're going to go through. All right, so I'm going to be referring to my little notes over here. I can't share my screen on this program that I'm using here to record, but I'll be looking at my notes. So, all right, so when we're talking about digestion, we're talking specifically digestion tonight versus absorption. Okay, so digestion is just the breakdown of our food, breaking it into more simple and smaller components. And then absorption would be actually taking those components and getting the nutrients from them and then utilizing the nutrients in our body. So we're not talking the absorption aspect right now. We're just talking the digestion aspect, because this is where so many people have issues. We talk a lot about absorption when we talk about leaky gut and nutritional deficiencies and that kind of thing. But right now we're just going to talk kind of these main higher level digestion issues. So the three big ideas that I think of when it comes to digestion are, I always look at it in a north to south fashion. And we'll talk about what that means, but we're going to talk about that several times. So just remember, digestion is north to south. So we start northmost, which would be for us in our brains, and then we go down south, working systematically in that order. Okay, then the main organs when it comes to digestion are the stomach, the pancreas, and the gallbladder. So again, with absorption, I mean, we all know that there's a ton of different organs that come into play when it comes to food and utilizing our food. But those are the main ones that we're going to be talking about: the stomach, the pancreas, and the gallbladder. And then lastly, for those three big ideas, is just that the digestion is key to healing. So there's a lot of different things in play when it comes to healing. But first and foremost, we have to make sure that we're actually breaking down our food, because if we're not breaking down the food appropriately, then we are just not going to be absorbing, we're not going to be utilizing it, and then we will have a ton of nutritional deficiencies that fall into lots of other categories. So digestion is key, and that's always the first thing that we want to be looking at. All right, so let's talk north to south. So what does that look like? So northmost is the brain. So I talk about this a lot. If you've ever had a consult with me, you've probably heard this. And we've talked about this in a couple different videos, but the main thing with the brain is getting yourself into a parasympathetic state. So when you are parasympathetic, meaning relaxed, not fight or flight mode, not busy, distracted, doing other things, when you're in that calm and relaxed place, your body's actually able to start the digestion process. So you see food, you think about food, you smell food, you're relaxed, and your body's able to actually start relaxing the different sphincters that go throughout the GI tract so that everything isn't all tight. It starts producing certain enzymes and chemicals that are necessary to start breaking down your food. Basically just kind of prepares your whole body, starts your saliva going, all of that kind of stuff. So it's a preparation. Your brain has to be ready to prepare your body in order to be able to digest. And if it's not ready in the relaxed state, then you're going to have some issues later on. So that's always that northmost point that we look at. After that is the mouth. So this is actually not even included in a lot of digestive things I was looking at. I was looking for a good like poster kind of thing, or at least a printout of the digestive system. And so many of the images didn't even have mouths. They just kind of started with the stomach, which I thought was really interesting, because with the mouth, that's the very beginning. So we have both mechanical and chemical breakdown that starts in the mouth. So obviously mechanical would be the chewing aspect. Super important for any of our foods, whether it's carbohydrates, proteins, fats, anything that we can start chewing on and getting the digestive, like the breakdown actually happening. And then there's the chemical aspect too. So starches or carbohydrates are primarily digested in the mouth by saliva. And so if we're not allowing our food to be saturated in the saliva and giving it enough time in the saliva, then our starches are not going to be actually breaking down as effectively. There's a couple other things later on down the tract that do help to continue the digestion, but if it doesn't start in the mouth, most likely you're going to have issues further on down. So with your small intestine, you'll have abnormal gut microbes, you'll have candida or yeast overgrowth, you can have issues with energy, blood sugar spikes, all that kind of stuff. Sorry, I'm losing my words tonight. All right, so after it goes from the mouth, then the food is actually called a bolus, and it goes down your esophagus, down to your stomach, okay? All of this stuff is we all know where it goes, right? But what happens actually in the stomach? So there you have chemical breakdown that continues to happen as the stomach kind of churns, as this churning motion. And then there's chemical breakdown too. So there's a few chemicals that come into play in the stomach. There is mucus, there is hydrochloric acid, which is really important, and we're going to talk about that more. And then there's pepsin, again, super important. Pepsin is a chemical that is needed for breakdown of proteins in the stomach. So the stomach is primarily where we're talking about protein breakdown, because we're going to have our hydrochloric acid there and our pepsin, both of which are working on all of the foods that come in, but primarily the proteins. We'll talk about what can go wrong in a little while, but just kind of remember that, okay? So we have our bolus down in the stomach, kind of that churning aspect, and then the chemicals coming in. All right, so now that bolus is turned into what's called chyme. The chyme is mixed together with that hydrochloric acid and becomes super acidic. From there, it travels down to the small intestine, and in the first part of the small intestine, which is called the duodenum or the duodenum, there are a couple chemicals that are secreted. So we have secretin and we have CCK or cholecystokinin. So these two chemicals are really important for stimulation of a couple different things. Together, they stimulate the pancreas to release a whole bunch of pancreatic juices and enzymes that help to further break things down. So it helps, there's a couple of chemicals that they break down the carbohydrates, your proteins, and your fats. And then also the CCK in particular helps to stimulate bicarb. So what bicarbonate does, or bicarb, is it takes that really acidic chyme and neutralizes it, so it's no longer acidic. So if that bicarb wasn't there, the chyme would pass down, and the pH is so low, so it's so strongly acidic that it would just burn a whole bunch of ulcers throughout the small intestines if it was able to go on down without the bicarb. So really important to have the bicarb, the rest of the enzymes that are continuing the digestive process. And then the other thing that happens is that the CCK, or the cholecystokinin, stimulates the gallbladder to release bile when there's enough fat. So when it encounters enough fat in the system, the CCK will tell the gallbladder, hey, there's enough fat, go ahead and squeeze and release some of that bile out so that the fat can be digested. So without enough fat in the system, and if CCK is not present, because further up in that more northernmost, in the more north regions that we were talking about, if those aren't doing their job, then that trickle down will be that the CCK is not there. Thus, the gallbladder is never stimulated, and then the fat that you have never gets broken down. And again, we'll talk about some of those symptoms later on, so you can know if that's actually what's going on with you or with your kids. All right, so once all of that happens, in the ideal world, all of this is happening perfectly. The food, or the chyme, now moves throughout the small intestine. And once it's there, it encounters a whole bunch of microbes. So we talk about this a lot, right? Because at Be Well Clinic, we talk a lot about leaky gut, microbes, dysbiosis. So when there's imbalance between different microbes, that kind of thing. So, so what we're talking about here is part of the job of the microbes is to continue the digestion process. So if our microbes are imbalanced, then we're not going to be able to have that appropriate digestion. But if we have a really good, solid, balanced microbes, then the digestion process will continue, and then the absorption aspect will happen, bringing the nutrients into the bloodstream. All right, from the small intestines, it goes to the large intestine. So in the large intestine, that's mostly important for absorbing water. So the reabsorption of water, or the reuptake of water. So if there's water that's still left in that your body needs, it's going to allow the water to come out through the walls. So a lot more of that the absorption aspect. And then it also makes several vitamins. So vitamin K, B1, B2, and B12 all happen in the large intestine. And then what's left just moves on and is expelled out as feces, as stool. Okay, so that is a typical picture of what's actually happening, or what's supposed to be happening through digestion. Okay, so now we're going to talk about what can go wrong and what it looks like in your body, and how can you help that without targeting the wrong things, right? So not chasing symptoms, not getting stuck on the pain that you're having, the nausea that you're having, that kind of thing. But how can you actually work from that northmost point down to the south and heal those in yourself and in your family? All right, take a sip. Okay, so what can go wrong? All right, so if we're going to start back at the top, okay? So in the brain, remember I was saying that the brain is important for stimulating secretions. It's important for motility, so actually moving things around and down the GI tract, for that constriction of so that tightness. And then for blood flow. So if you are parasympathetic, or in that relaxed state, then all of those things will go well. If you are not parasympathetic and you are more in that fight or flight mode, where you're more sympathetic or you're more like distracted, doing things, stressed, that kind of thing, even if it's not like a high level stress, even if it's just a basic level of, you're trying to talk on the phone, you're trying to keep dinner going, you're trying to help your kids, your mind is all over the place, then these things are not going to work well. So you need to be in this parasympathetic mode for the secretions, for food to actually move down, and then for increased blood flow to help with the absorption, reuptake of nutrients. So if we do not have those, then let's just kind of think through what, picture-wise, what that could look like, right? So symptom-wise. So if we don't have the secretions that are like the saliva coming up, right? Because our brain's not in the right space, then, like I said a little bit before, we're going to have more candida issues or yeast overgrowth. We'll have more of that dysbiosis in general. So just your bacteria and different microbes in your gut being off balance. So if you do have issues with leaky gut, if you have issues with kind of those intestinal pains and cramping, bloating, that kind of thing. If you get bloating within the first couple hours of eating, between 1 or 2 hours of eating, if you have this feeling of excessive fullness, a lot of times following eating, a lot of times that is because of what we just talked about. So because your brain's not in the right space, everything is tight. Your microbes are not able to digest your food. The secretions or the enzymes are not able to be produced to create that digestion. And so that's why you're having those symptoms. So when you have those symptoms, you don't need to look immediately at, well, it's my stomach or it's my small intestines or, things are all stopped up. It must be my colon. Always start up top and think through, am I relaxed when I'm eating my meals? It can just be something as simple as that. So a couple ways to get yourself to being relaxed would be a couple things we've talked about in the past, right? So if you've been watching videos, you probably know these, but there's a reason why pretty much every culture has a ritual of giving thanks, saying grace, saying a mantra, having something that they do before they eat to lead them into this calm, relaxed space. So for you, that might be saying a prayer, that might be thanking the chef. I always really like to encourage laughter before a meal to get you into that parasympathetic space. And so whether that is you're telling a joke, you have a funny song on, you've had a dance party right before you eat, something like that, just kind of getting yourself in this atmosphere of being really happy, joyful, calm. And then several deep breaths is always a really, really, really good way to go. So 3 deep breaths, everybody at the table engaging in this. And when you do it all together with everybody, it kind of puts everyone in that space. So hopefully kids are less dependent on you for a minute. You can just take a break. You're not trying to fix all the problems while you're trying to eat as well. All right, so that is the northernmost point that we're starting with. Okay, next is if undigested particles, so if we're not chewing appropriately and allowing the food to be in our mouth being saturated with saliva for long enough, a lot of the same things are going to happen. So you'll have the dysbiosis or the imbalanced gut microbes. You'll have leaky gut issues with candida. You can have, when you get candida issues, a lot of times it can manifest as brain fog, fatigue, a lot of mental things in addition to GI things. So if that sounds like you, some of the just brain fog and fatigue and just feeling like that mental clarity kind of thing is not there, then I would start with this. Always start at the top, check your brain. If you're doing that parasympathetic kind of getting yourself parasympathetic, you're like, yes, I'm doing that. So now what? Now we go to the mouth. Okay, let's check the mouth. Are you chewing the recommended 30 times per bite, right? Sounds like a lot. Try it out. It kind of is a lot, but you'll notice you don't have to do 30 times every time. If you have that in your mind, you'll actually begin to be chewing enough so that when it's chewed up enough, you're just going to swallow it, right? But you want to start thinking about that. So 30 chews for every single bite. Giving the food enough time in the saliva, getting broken down, that kind of thing, so that it's not a mouth issue. So now we know our brain's in the right spot, mouth's in the right spot, and now we can move on down. So if your brain's in the right spot and your mouth's in the right spot, the food is able to go on down. Now it's called a bolus. So the bolus goes down all the way down to your stomach, right? Okay, so here we're going to talk about hydrochloric acid, which is super important. If you don't have enough hydrochloric acid, there's a good chance that you're going to have a lot of those things that we talked about before: bloating, excessive fullness, a lot of the burping, gassiness, that kind of stuff. HCl, or hydrochloric acid, is inhibited by several different things. So first, it can be inhibited if your brain's not in the right spot and if your mouth's not doing the right thing. But it also can be inhibited by low zinc, but it's a little bit of a chicken or the egg kind of situation. So if you don't have enough stomach acid, then you're not going to be absorbing or digesting and absorbing your foods. If you don't have the zinc, then it can be really hard to be having enough hydrochloric acid, okay? It can't, and we'll talk about that in a minute. So hydrochloric acid is also inhibited by stress, by alcohol. If you are having too many carbohydrates, that can actually cause like an imbalance in carbohydrates to proteins and fats, can cause lower stomach acid. And so those are the main things to be looking at. So stress is a huge one. And stress can be external or stress can be internal. So a lot of times stress is brought on by what we eat, whether it's an allergen, something that our body doesn't respond well to for a true allergy, or if it's a leaky gut thing. And we need to first heal that gut so that we can have enough stomach acid to actually be absorbing what we need. Stress, external stress, that's talking about even if you have a lot going on that you can't, like externally, that you can't necessarily rid yourself of, if it's family issues, work issues, that kind of thing, at least having that dance party, taking a couple deep breaths, thanking the Lord for your food, thanking the chef for your food, at least those kind of things can kind of trick yourself into being into a less stressed position, so that you can have more of the hydrochloric acid to go along and cause the digestion of your proteins. All right, let's see. Oh, another thing is that if you don't have enough stomach acid, a lot of times your food is actually just going to either ferment or get rancid or putrid inside your stomach. Because it's not breaking down. So it kind of sits there because it's not broken down enough to pass on through to the small intestine. So it's just sitting there. If you have food that, let's use carbs as an example. So if you have carbohydrates that are not digested because you haven't gone through the steps yet, it's going to sit in your stomach and start fermenting. So if you've ever fermented anything, or if you're familiar with beer or anything like that, if it's fermenting, it's usually bubbling, right? So you're going to have this bubbling aspect going on inside your body. That is going to push up on that esophagus, and the little hydrogen you do have is just going to push on up to your esophagus and cause that sensation of heartburn. So generally, heartburn itself is not an issue of too much stomach acid, but it's actually an issue of too little stomach acid. And this is something that I saw all the time when I was working as a nurse in the hospital, where people would come in with heartburn, right? Or that acid reflux kind of stuff. And we would just give them antacids. So we would give them medications to reduce the amount of acid that they had, which is nice for the beginning part, right? Like it helps with the symptom control. But in the long run, if you're putting somebody on that long term, which typically would happen, it can actually be really, really detrimental, because the breakdown, your digestion of all of your foods are really inhibited. And then after that, you basically issues with absorption. So you're not going to be getting, even if you're eating really, really good foods, you're not going to be getting the nutrients from those foods. All right, so now we move on to the pancreas. Okay, so if you don't have that level of stomach acid, like we just talked about, then the chyme or the food has to have a pH that's low enough, so acidic enough, to stimulate the next hormones or the next chemicals to start working. So if it's not low enough or acidic enough because you didn't have enough stomach acid, then secretin is not going to be there to release the pancreatic enzymes that further the digestion. And then it's not going to stimulate the CCK to neutralize the chyme also. Now, if we don't neutralize, like we said before, it's going to be really acidic as it's passing down, and it's going to cause a lot of those ulcers. All right, then if the CCK is not there, it's also not going to stimulate your gallbladder to secrete bile so that you can digest and absorb your fats. All right, so let's talk about what this looks like with symptoms, right? So we talked through the stomach, we talked through that heartburn aspect. A lot of that is also goes along with all of that same stuff. So we talked about that like fermenting kind of aspect. You're going to be bubbly, you're going to be bloated. As in addition to all of this, you're going to be having nutrient deficiencies because you're not breaking down the food and getting the nutrients, right? That's going to go along with mineral deficiencies. So that can go toward, that can cause headaches, that can cause, again, some of that brain fog, that can cause really deficiencies throughout. So you have poor immunity, poor healing, pretty much anything that happens when it comes to what we deal with here at Be Well, and me as a nutritional therapy practitioner, it's pretty much all nutrient deficiencies, right? So all of this stuff, I always start at the top. So I'm always looking brain first, mouth, stomach. Is everything working in succession? If those things are working, then the rest really should be working. So if we're seeing evidence of the ulcers, if we're seeing evidence of fats not being digested, we really need to be looking higher up, okay? Sometimes we'll give some therapeutic support. So maybe that would be bile salts, or maybe like to help with the gallbladder and the fat absorption. Maybe we'll do some pancreatic enzymes to help kind of trigger those to come back up. But I don't like those as a long-term solution. We always want to see what is the actual cause, what's going on. Is there these stressors? Do we need to do a short-term thing so we can get enough zinc into your body so that you can start producing the stomach acid, that kind of thing. Okay, so that's once we hit the gallbladder, then we go down to the small intestines, we go down to the large intestines. And that kind of stuff we have talked about kind of in depth. So for sake of time, I don't want to talk too much about those because a lot of that is more the absorption, the leaky gut stuff, and we have plenty of videos on that. So the main things, like I was saying, that I want to address are the north to south process. So the brain, the mouth, the stomach, the pancreas, the gallbladder, and figure out for you. So for you as an individual or for you as a parent, what can you do to identify what's going on? Because we've been talking a lot about science around here too, right? So the scientific process of you have an issue, you ask a question, and you can do a couple different experiments to analyze what's going on and then figure out what the answer is, right? So a big thing that I want to address is not, I don't like chasing symptoms at all. And I mentioned this already. But say you have nausea, okay? A lot of times we think of nausea associated with the gallbladder, and it is. If there's nausea, most likely there's some kind of gallbladder involvement. But do we go immediately to the gallbladder and say, okay, well, you're nauseous, so your gallbladder needs help. We're just going to pinpoint the gallbladder and help that, and then everything will be fine. Well, sometimes we can. Sometimes, like I said, we can do that like therapeutic, just kind of a stimulation for your gallbladder to help your gallbladder work. but I don't like starting there. So let's always start back at the top, okay? And this is just a process. I've mentioned this so many times because I want you to start being able to incorporate this into how you operate and how you see your family and how you help your family digestively. So, so we'll use the example of nausea, right? So first of all, before we can even look at the gallbladder, we have to look back up top, okay? Like we were saying before. So we're gonna look at that parasympathetic aspect. If you're eating the right foods, so there's a whole other thing if you're just eating foods that are not helpful or packaged things that are not truly food, right? But if you're eating foods that are healthy, properly prepared, nutrient-dense foods, but you're still having these issues, then let's figure out where that breakdown is, okay? So are you parasympathetic or is your kid parasympathetic? Sometimes it's really hard to tell with a kid because they might have these things going on that they're not actually telling, right? So they might be worried. If it's an older kid, they might be worried about something else going on in school. They might be worried about the fact that, just to use a personal experience, maybe their little brother is in the other room and destroying all their toys. And that's just weighing on them so hard, and they cannot get parasympathetic because they're so worried and they just want to get up from the table and run and rescue their toys, right? They can, it's sometimes hard to tell with kids, but doing those things that we were talking about as far as deep breaths and getting yourself into a relaxed state, getting, blowing on a pinwheel or blowing bubbles or doing the dance party, telling a joke, doing something silly, drawing before you eat so that you can kind of get into this relaxed mode, that kind of thing. Always with kids is really, really helpful too. Okay. Next we'll go down to the mouth. Okay. So, remember, even if a lot of our fats, because we're doing that nausea example with the gallbladder, right? So a lot of fats, you don't really have to chew that much, right? But you do still have to have this motion. It's really helpful for your body to actually have this like chewing mechanical motion, and getting the saliva engaged and getting all of those things engaged, regardless of what the food is, get the rest of the cascade moving, okay? So then it moves on down, goes to the stomach. If you're doing the right things there, then we should hopefully have the stomach juices, all of that kind of stuff that's incorporating it, okay? If not, what are a couple things that we could do? So, well, let's see. I think I was going to say that later on, but you know what? We're just going to go for it. So basically, some aids to be looking at right off the bat would be what we just said, talking about the brain, the mouth. Drinking some warm liquids right before you eat can actually be really helpful, like warm water with lemon, a stock or a broth. That's why a lot of cultures actually have that first, kind of the first course is like miso soup or a stock or something like that to, or the warm water to just kind of start facilitating that stomach acid being produced. So you can do those. You can do some bitters drops are really, really great. And then making sure that you're avoiding the things that do cause complications, right? So smoking, alcohol, coffee, refined foods, too many carbohydrates, flours, sugars, all of those are going to be decreasing stomach acid that then causes the trickle down of issues later on. So again, if we're working through our nausea example, before we even get to looking at the gallbladder, we've looked at all of these different things. And there's a good chance actually that once you correct the higher, more north points, you're not even going to really need to do anything with the gallbladder. So again, sometimes it can take a little while. So if you need to do some symptomatic control with bile salts or something like that, like ox bile or something, that can be helpful. You might need to do some symptomatic control with giving yourself actually some more stomach acid if your body's just having a really hard time with getting relaxed, right? Or with kind of participating in that making sure that you're doing all the chewing and that kind of thing. It can be really helpful to give yourself some extra hydrochloric acid or some pancreatic enzymes, that kind of thing. But again, this is always something that we want to do really short term, okay? And then lastly, with those kind of main things to be looking at, make sure you're getting the dietary nutrients that trigger that cascade. So again, the soups, the warmth in liquids before an actual meal, the increased fats, the high zinc foods, even some really easily digested foods like egg yolks that have zinc in them, that kind of thing. So those are going to be kind of the go-tos as you're first looking through that north to south aspect. And then some other things that I wanted to touch on that are basically things that I kind of just went over, but sometimes if you need that symptomatic control, the bile salts for the gallbladder, the hydrochloric acid to help increase your stomach acid so the rest of that stuff can start, all the enzymes and stuff can be produced, the warm liquids, the bitters, and then also G vitamins, which are the calming of the B vitamins. And so a lot of times we will recommend those calming vitamins for people so that you can actually kind of get your heart to settle, get your mind to settle, get yourself in that parasympathetic state. So if you're doing all the things and you're like, okay, I'm breathing and I'm praying and I'm blowing on a pinwheel, like what else am I supposed to be doing here? Sometimes those can actually help. Other things that can help there would be adrenal support. So whether it's herbal like that, or whether it is something that is more of a gland, actually like eating adrenals or something like that to help out with the stress aspect. All of those things can be really nice to help your body flip from that sympathetic fight or flight to that relaxed state, because it can be really hard to just get yourself over from one to the other sometimes. Our bodies are supposed to be able to do that, but with the world the way that it is right now, the way that's been going for the last 100 years, things are just more stressful, things are active. So many people have a TV in their kitchen or have a podcast on, and it's really hard to kind of make that flip. Our bodies have kind of forgotten how to make that flip. So there's other things that you can do. There's other therapies. Chiropractic helps a lot. Acupuncture can help a lot. There's a lot of different things as far as like different modalities that you can get into, different emotional support, that kind of thing. But we're really focusing on the digestive aspect right now. So just working through what we've discussed to get your brain in the right spot, mouth in the right spot, stomach in the right spot, pancreas, gallbladder, and then most likely you're going to be good. So even if you have small intestine issues, a lot of times you can be healing, working on the leaky gut issues, taking away a lot of the offenders and the toxins if you are working through this north to south process. So that is the basics of what I wanted to go through today. So again, I know, when I learned the digestive system through nursing school, and I went to a great nursing school, and they didn't teach me wrong things necessarily, just not everything interconnected, right? And so a lot of times, like I was saying before with the example, if there was heartburn, we would give the person an antacid. If there were gallbladder issues, we focused on the gallbladder and we'd say, okay, maybe you have gallstones, maybe you have, your gallbladder is congested. Well, we didn't really look at why is it congested or sludgy, which is just because you probably are not getting the fats that you need, or you are your gallbladder is not stimulated to secrete the bile that's in it, right? So then it just gets really congested and bogged down and sludgy. And a lot of times people who had those issues would just be referred to surgery, which is really sad because there's so much that we can do if we take the approach of the gallbladder itself is not a separate entity, right? The stomach, with the hydrochloric acid, is not a separate entity. These are not things that we need to take in isolation, but these are things that we need to take in looking at the whole body, the body as a whole, even if we're just focusing on the digestive system right now. And there's a lot more that goes into this. I'm going to be talking later in another video, I think, about the HPA axis, which is basically how our body talks to itself, the different aspects and how the communication happens. And so it all is really, really cohesive, but you don't have to get worried. Your kid's complaining about having a stomach ache. You don't have to start thinking like, okay, well, how does the hypothalamus work? That stuff, it works. Their body is working, but what you really want to be focusing on first and foremost, this is what I think from as a nutrition practitioner especially, is looking at digestion, right? And so starting in the brain, moving to the mouth. Is the esophagus working? Because is the brain calm? Everything's going down. Stomach, pancreas, gallbladder, moving on down. So anyway, that is a quick recap of digestion and how it works. And even that is more than probably a lot of people have gotten, even who have who have degrees like I had as a nurse. And so it's really good, like something that I just always like to come up with parents, or talk about with parents, is that you do not need a degree. You do not need any kind of high-level education, even high school diplomas. Just knowing how the basic body works and being able to backtrack, taking that scientific method and being able to think through, all right, I have this question, let me just think logically, starting at the top and moving on down. And you can heal yourself and you can heal your kids. So thank you for being here. Thank you for listening. This is giving me a hard time with seeing comments. So if anybody did put in comments, I am trying to figure out why it's not showing them. But I'm going to kind of tinker with that just for a couple minutes. So if you do have any questions or comments, feel free to put them in, and I am hopefully going to see them. And if not, thank you for being here. For all of you who have been here, I appreciate it. And we will be back in a couple weeks with another video. But in the meantime, we got blog posts going up. We have a lot going on over here in both of our clinics. So make sure that you are on our email list. If you're not with Be Well Clinic, you can go to bewellclinic.net and make sure you get on our list so that you can see all the classes that we have coming up, see all of any updates for the holidays, anything like that we have going on. So. All right, guys, I am tinkering around here, but I think we are about done here. So if I did not get to a comment, for some reason it did not pop up for me, I apologize. And I'll try taking a look back and seeing if I can, if I see any comments that I missed while I was talking, then I will certainly answer, and I'll try my best to get back to the individuals who may have asked them. All right, guys, have a wonderful night, and I will see you later.